Depression, anxiety and phobias. Common mental health problems affect a quarter of Liverpool's population, but with patients waiting almost 5 times longer than the national average to access therapy services, it's a problem which isn't going away. Mental health services in the UK have been underfunded for decades, and people of all ages are being let down. This year alone, 1 in 4 people in the UK is expected to develop depression. Those suffering receive the needed help too late or no help at all, meaning that thousands of lives are being put on hold or completely ruined. Amanda knows all too well the damaging effects mental health problems can leave. After an attack left her with a mental breakdown, she is now recovering with the help of Imagine, a mental health charity in Liverpool, where she volunteers as a teacher to help others in her situation.
Because you can't see people's mental illness, often people assume, rightly or wrongly, that you're mad. All my students and colleagues, they've all experienced a lot of stigma about mental health. Unfortunately, I had a mental breakdown after a violent attack in my last place of work, paid work that was, and I became very, very poorly. So after my physical injuries started to heal, my doctor and I spoke about talking therapies and creative therapies rather than taking prescribed medication. And I joined our group at that time, which was a support group for all adults who were in recovery of mental health, being poorly, and that was the start of wanting to start being voluntary working.
Mental ill health is increasing. The diagnosis of it is increasing, but it's increasingly difficult to receive services for people to recover. The service we provide is very, very much individualised and long term, but without it being institutionalised. So we're aiming to integrate people as far as possible into their local communities. It's different really from anything that the state sector can offer currently.
In January 2016, the NHS England has committed to investing an extra £1 billion in mental health services by 2020. Where's the money coming from and where will it be spent? The government is yet to answer this £1 billion question. Bye, Get Velite, JMU Journalism.